the infrared regions. So terahertz frequency therefore is this figure 0.1 times 10 to the power of 12. 10 to the power of 12 is trillion. So that is the frequency. So if the frequency is so high, the wavelength therefore is very short. And what is it used for? Terahertz is primarily used for telecommunications, where they are better than microwave. So those of you who use mobile phones, if you're using 5G, you are using the waves that you're using is microwave. And coming soon, you will have 6G. 6G uses terahertz frequency. And then they're also very useful for detecting substances. So it's used in security and military applications. And the interesting thing about terahertz frequency compared to all other frequencies is that almost every molecule has a fingerprint on identified signature in the terahertz range. So this is where terahertz is, infrared and up to ultraviolet, X-rays and all that. These are very harmful radio frequencies. On the other side, lower frequency, longer wavelength, you have things like microwave, radio waves, you get television, radio, everything, all in this frequency. So that's where terahertz is. Visible light is this narrow strip from red to purple, okay? And of course, we see only this range. All the waves on this side and the other side, we cannot see at all. So the breakthrough, as far as terahertz is concerned, comes in the 1990s, where we developed tools and instruments both to generate, to detect, and to monitor terahertz waves. And the significance was in 2011, when a very ancient 18th century painting, paintings in those days were all painted over. So when you see a painting, if it's an old painting, there may be a lot of other layers underneath. So they look at this and they could find a previous painting in 1771 with an artist's name on it. So that's very interesting. This ability to penetrate substances is being used in archaeology nowadays. So now they can look at things underground without having to excavate to open it up. They use this terahertz, they can see what's underneath. So that's amazing. Now before this period, there was something called the terahertz gap between X-rays, infrared and radar waves. So what is the terahertz gap? Terahertz gap refers to the way this frequency is studied. Waves to this side used to be studied under electronics, radio waves. Waves on this side used to be studied under photonics, that is under light. And this, because light waves are here, and we have all the techniques to study light waves. Terahertz is in the middle. So people don't know what to do with it. Of course now, terahertz is now studied intensively and mostly using techniques from photonics, that's from the study of light. So these are the applications, as I said just now, telecommunications, 6G, which is coming in the future, is terahertz. For military and security application, they can image. In other words, you can know what a person is hiding beneath all the clothes or beneath all the whatever cover there is. So you can see it's also used in agriculture, where they can monitor drought, pesticide control, and so forth. And it is interesting because in drought monitoring, what they look at is the amount of moisture in plants. And from the amount of moisture, you know whether a drought is coming. And so it's very useful in that regard. In health sciences, because they resonate at the same frequency as the human cell, it is very much used. So because of this property, TeraHertz has been called the light of life. So TeraHertz has the ability to produce healing and produce normalization of human cells. And this healing property of TeraHertz has two aspects. One is heat. Now, this particular property of TeraHertz, it shares with infrared, where if you were to face the sun, not the ultraviolet ray, in early morning, let's say, where there's less UV light, it's supposed to be helpful because infrared is able to penetrate your skin, warm and open up all the blood vessels, increase detox, and so forth. But besides the heat energy, TeraHertz has another energy due to its vibration. Because if you remove the heat, which some scientists are able to do, remove the heat element, TeraHertz is still able to cure due to the energy of the vibration. And it's the vibration that heals. And certainly there's a lot of evidence to show that different vibrational frequencies can heal. So these are two applications in health sciences. One is for diagnosis. There's been a lot of instruments that are using TeraHertz to diagnose what's underneath, especially to diagnose tumors, fractures, and things like that. And because it can penetrate deeper, you can outline whatever is underneath very clearly. Another use of TeraHertz is in therapy devices such as iTeraCare, and this is what we are talking about. So the properties of TeraHertz as far as therapy is concerned are all listed here. They are low energy, non-ionizing, and the energy corresponds to hydrogen bonds and van der Waals forces. Hydrogen bonds are bonds that come about because of hydrogen, as the name implies, and it attaches to mostly oxygen. It can also attach to nitrogen. And because of this property, is absorbed by polar compounds, which are conductors of electricity. These hydrogen bonds are very weak forces. As you know, a lot of compounds are formed, they become totally different once they are bonded together by molecular forces, such as sodium chloride. Your common salt is made up of sodium and chlorine, and yet when bonded together, they become salt. So it is rather unique in that sense. It doesn't alter the property of the atoms that are bonded together, but it creates changes. A good example is water, where the oxygen are bonded to the hydrogen molecules through these hydrogen bonds. So that's why there is water molecules tend to accumulate together, and you have this phenomenon called surface tension, where you pour a glass of water and there's still water left over. That's because the water molecules are bound together. When you break up the hydrogen bonds, the molecules then become like sheets and they can penetrate deeper. That's the advantage of water, where the van der Waals forces are disrupted and water is in the form of sheet. So TeraHertz is able to penetrate through non-conducting material, wood, paper, even walls. Nothing can stop the TeraHertz wave from being able to see through to the other side. So the only thing stopping the penetration of TeraHertz waves is distance. It cannot go very far. That's why if you realize from about 4G onwards, which make use of microwave, you find that we need more base stations because they don't travel very far. Older mobile devices use lower frequencies longer wavelength, they can travel very far, like radio waves or sound waves or whatever. But when it comes to microwave, they don't travel far, so we need a lot of base station. 5G, which is microwave, is because of its increased frequency, requires more base station, and 6G even more. Okay? But because of this ability to affect human cell, TeraHertz can change the shape of molecules, and certainly different frequencies, different energy levels can change the frequency quite significantly. And this is being intensely studied for two reasons. One, because we are using it in our telecommunications. There's a concern about the safety of 6G phone, and indeed there have been some papers coming out to say that at what frequency, at what energy is it safe. And the other thing has to do with the fact that they want to know, because there are a lot of health applications. It's our TeraCare devices, the energy coming out, is it safe or is it not? So because of this, we also find that certain energy biological systems change. Biological systems change because of neurotransmitters, chemicals, which activate what we call receptors, and then you have all the action in our cells. And therefore, because of that, we need to understand how TeraHertz react with our body tissues. So the TeraHertz effects on the human body are these 5 things. One, it opens up blood vessels. It has this ability to do so. Secondly, because it causes water to vibrate, water becomes activated. Thirdly, it can activate cell organelle. These are minute organelles in the cell, mitochondria, which increases energy production. And then cells that are hyperactive in inflammation, they can normalize it. And it also has an activity on DNA, which is to unzip it. Okay? So open up blood vessels. TeraHertz has this ability to open up blood vessels. When the blood vessels are opened up, because blood in the arteries are from the heart and under pressure. So when they are under pressure, what happens? Water, nutrients, oxygen can leave the blood to go into the surrounding tissues to provide oxygen, to provide sustenance, any nutrients that the tissues need. As it goes to the venous side, it's low pressure, water, carbon dioxide, toxic substances, waste products can enter the capillary. Now, because this is not under pressure, so this is not very effective. So not all the water, not all the toxins, not all the waste products enter into the veins. And that's why we need lymph vessels. Lymph vessels are like drains. They drain the excess fluid, excess carbon dioxide, excess water, excess waste products, and drain it back to the heart and into the bloodstream. So TeraHertz is able to regulate inflammatory response. Inside the blood, you see white blood cells. White blood cells have nucleus, different shapes. The nucleus are different shapes. And when there is an attack by bacteria or viruses, when you suffer a cut and bleeding and your tissue is exposed to the external environment, white blood cells will rush to the scene and protect you, seal off the opening, and it will attack any bacteria, any viruses, as well as remove any foreign body. For example, if you are in a place where there's an explosion, you will have some fragments embedded into your tissue. So this white blood cell will surround that external foreign body, we call it, which is a fragment, and try and isolate it and then remove it. So this is what TeraHertz is able to do, regulate the immune response. Inside the normal cell, you have something called a mitochondria. This is what a mitochondria looks like. It has many folds. There's many folds so that the surface area is increased for a lot of activity that takes place there. What are some of the activity? One, it produces energy. All the energy comes from what is known as the energy cycle, which produces ATP. ATP or triphosphate is where your energy comes from. And then it's able to transport metabolites and ions. It's able to synthesize all kinds of things, cofactors and all that. So your gene gives the menu as to how you make a particular chemical that your body needs. It's able to read the menu from the gene and translate it and make whatever chemicals that you need to make. And you can import protein, process them. You can do a lot of things. In fact, all the activities inside your cell is controlled by the mitochondria. And the interesting thing about the mitochondria, it comes to my mind just now. You inherit your genes from your mom and dad, right? One from your father, one from your mother. But because the sperm cell only contains the DNA of your father, it doesn't contain the other parts of the cell, which is what is called the cytoplasm. And the mitochondria is in a cytoplasm. So all the cytoplasm that we have, all the mitochondria that we have are all inherited through the mother. That's a very interesting concept, because it means that while your genes are from your father and your mother, all the production, all the mitochondria is from your mother alone. And this is something that scientists have made use of when they study inheritance. So, besides causing the mitochondria to produce all kinds of things, it also causes apoptosis. Apoptosis is like suicide, when the cell commits suicide. In apoptosis, when a cell reaches the end of its life, they are then destroyed. And when they're destroyed, the fragments are able to release signals that say, find me and eat me. So they're engulfed by certain white blood cells called phagosomes and degraded. TeraHertz also has the ability to kill bacteria, viruses, parasites, and all these things. So therefore, whether you have an infection of any sort, if you shine TeraHertz rays on it, it will sterilize it, it will kill them. All this. And in fact, that's how I got interested in TeraHertz radiation, because it was used during the COVID period for COVID patients. They were able to kill the COVID viruses by using this technique. And TeraHertz also can activate DNA. It has been shown that what TeraHertz is able to do is able to open up the DNA. Now, you need to open up the DNA for two purposes. One, when you want to duplicate the DNA to produce another pair of DNA. The other reason why you need DNA is, like I say, the DNA contains menu recipes for the production of various things that your body needs. So all the information is coded in the DNA. Certain protein, such as the primer or the RNA printer, are able to read and able to translate the DNA and actually produce the actual chemicals that your body needs. So because of this, TeraHertz is able to activate and produce, make your cell produce all other chemicals. This helps in healing. One of the reasons why it's able to heal is because of this activity. It activates, it stimulates all this activity, and that's how you can produce the necessary chemicals and the necessary antibodies that you need to fight whatever infection that there may be. So let's come to and talk about psychosomatic disorders. Psychosomatic disorders, we define it as physical disease or symptoms induced or aggravated by intense emotional states. Example, when you're under stress or you're in trauma. Conditions of trauma. Physical trauma can also produce intense emotional state. When you're hurt, you will feel painful, you feel a lot of angst, anguish. So while the physical disease can be noticed, often the emotional state is often overlooked, and you need time, you need patience, and you need resources to understand them. And often these disorders, you can't find any cause. No cause can be found. So in the past, people tend to dismiss them. Oh, he imagined all these things, or he's just seeking attention, or whatever people may say. So treatment often is complex and requires a combination of medical and psychosocial interventions. In other words, you need psychological as well as social. Why social? You would have realized that when you're with people, especially people who care for you, you are much calmer. So outcome, therefore, depends on many factors. And that's what we'll go through. The commonest psychological factors are irritable bowel syndrome. And then you have eczema and psoriasis. And then you have chronic pain. Then you have asthma and something called chronic fatigue syndrome. I wouldn't cover depression and anxiety because that's totally a different classification altogether. So let's talk about irritable bowel syndrome, or IBS. It's characterized by abdominal discomfort, a feeling of bloating. You feel bloated up, and change in bowel habits. So mostly it's diarrhea, but sometimes it can be constipation. And it's triggered by environmental factors: change of routine, emotional stress, infection, toileting changes, or even diet. So right now, there is no treatment for irritable bowel, symptomatic treatment only. It persists. It won't go away on its own. It can sometimes get better, but it will be present. And after some time, it can lead to all these problems: hemorrhoids, mood disorders, and impact the quality of your life. So that basically sums up what IBS is all about. What are the symptoms? Well, usually it's female from late teens to early 40s. They have abdominal pain, discomfort, sharp pains, cramps, bloating, the stomach is distended, there's fullness, there's a burning sensation. Often there's a lot of mucus in the stool and a lot of gas, a feeling of urgency, a feeling that they never can completely evacuate out there. After evacuating, they still have a feeling as if there's still something inside, It's also associated with some symptoms that may not be so common: backache, headache, nausea, vomiting, agitation, flushing, fainting, and pain when they're evacuating. Recently, there's been a lot of interest in the bacteria found inside our gut, in our large intestines. And this bacteria together constitute what is known as a microbiome. This microbiome is now increasingly recognized as important for our health. And that's why people are changing the diet to more healthy diet. A more healthy diet is one that fits your microbiome. So if there are bacterial imbalance in the microbiome, it contributes to IBS, and that's been found. In fact, one way of treating it is to improve the microbiome. Allergy to gluten, lactose, and so forth. Now, you think that your digestion is done by your own digestive juices produced by your pancreas, right? But increasingly, we begin to understand that a lot of the digestion take place because of the bacteria in your large intestine. So this microbiome contribute to your digestion, okay? And that's why it's so important in something like irritable bowel disease. So inflammation, intestinal hurry, because your microbiome not doing anything, so you always want to go to the toilet to evacuate. So there you are, irritable bowel, basically abnormal contraction, diarrhea, constipation, cramps, a lot of wind, low FODMAP diet. Basically, it has been found that low FODMAP diet means low starchy fruits. I will talk about that later. These are low FODMAP. These are things that we shouldn't eat. In fact, you see some of the things that we shouldn't eat, which are supposed to be helpful, are here, isn't it? This is high FODMAP. If you're irritable bowel, this is not to be encouraged. So forth. So, if one has constantly bowel symptoms, we should consider low FODMAP diet. It stands for low oligosaccharide, monosaccharide, disaccharide, and polyols. These are very starches. For coping with IBS, adopt a healthy lifestyle, educate yourself, communicate regularly, keep a food diary to see what trigger, try cognitive behavioral, consider medication like antidepressant. I think diet is pretty important here, and the important thing is that you must make sure it is not due to other things. So colonoscopy is mandatory to ensure that you are not dealing with something serious. There are medication to reduce the contraction and to relieve the pain. There are probiotics available to reduce the gas, the diarrhea, and the bloating. And there are certain substances that can release hormones, enzymes, and neurotransmitters for the constipation and to reduce your hyperactive intestine. Low FODMAP stands for fermentable oligosaccharide, disaccharide, monosaccharide, and polyols. This kind of starches are harder to digest and believed to be contributing to this. No point attempting detox. It is one of the situations where detox really don't help. It makes it worse. You really got to regulate your bowel habits, particularly your microbiome. It has been shown to be quite important. So how about TeraHertz and stem cells? TeraHertz can help with reducing inflammation, improving the way your gut function, cause relaxation, reduce the cortisol level causes stress, and this is no good. So TeraHertz can stimulate digestion. And TeraHertz can help your gut healthier by changing the composition of the microbiome, and that's what some studies have suggested. And this is something very interesting that TeraHertz is able to do. It can also ease the pain and protects you against oxidative stress. In other words, there's an antioxidant effect. Now, how about stem cells? Stem cells has been found that in irritable bowel, the gut, which normally have stem cells, appear to be depleted of stem cells. There are not enough stem cells there. So maybe that's why you can't get faster recovery. So mesenchymal stem cells have been used to reduce inflammation of the irritable bowel by regulating the immune system and promote tissue repair. Mesenchymal stem cells are obtained from either the fat cells or from the bone marrow by taking certain supplements to irritate them and release them. they promote tissue repair. Now, you notice that certain starches are able to bring on the irritable bowel. Conversely, certain starches, certain polysaccharides, such as beta-glucan, are very powerful stimulants of stem cells. So what do? That's why some people taking stem cell nutrition, like ACEs, for example, you find that they cause some people to have tummy aches when they take them. And that's because of this, of what we say just now. They are not low FODMAP diet. They can irritate the bowel to have diarrhea. And yet, by their very nature, they can stimulate stem cells. We can reduce inflammation automatically. So sometimes we have to be careful. And this is not actually a toxic crisis. This is the effect of the interaction between diet and your condition. It is a necessary phase that you go through. But the beta-glucan, if taken in the right amount, not too much, not too excessive, it can stimulate stem cell production. So this is something that you need to recognize. So we now come to eczema and psoriasis. Eczema is a skin rash that a lot of people have. Psoriasis is an autoimmune condition. It's a disease. Both are chronic conditions. Eczema is also known as atopic dermatitis, redness, inflammation, and irritation. Affects almost everybody, including children. Eczema appears anywhere on your body, especially on your hands, cheeks, scalp, front and back of knees. In psoriasis, an autoimmune disease, it appears everywhere on your skin, there's an excessive production of cells, causing scaly, inflamed patches. In Chinese, called 牛皮, cowhide, cowhide, thickened. It varies in severity from small patches to covering the entire body. Eczema cannot become psoriasis. They are two different conditions. They are not the same. So this is eczema on the face, on the neck, on the hands, on the legs, on the body, on the arms. These are eczematous conditions. This is psoriasis. See the scaly appearance, scaly on the hands. It can cover the entire back. So it can be quite bad, psoriasis. And it's not very pleasant. Yeah. And you see this at skin clinics, National Skin Center and so forth, where you see people with such lesions. So the difference between eczema and psoriasis, itching is very intense in eczema. There's oozing and there's crusting, crust form. Crust is different from the scales. Scales, even if you don't scratch, even if it's not itchy, you can see them. And they appear on the external surface. External surface is on the outside surface. Okay. This appear on the flexural surface. Flexure is towards the midline. There you are. Which is which? Which is psoriasis? Which is eczema? Can you tell?
This one seems like.
Where is the scale? Is there any scale formation? Right, yeah, this one. That's correct.
Right.
Yeah. So once you see the whiteness that signifies scale, that's where it is. Generally, eczema generally less inflammation, dry and itchy, Skin appear thin and swollen, flare up, usually borderless. In other words, no clear-cut border. Flare up are obvious and distinct. Skin appear thick and raised. Okay. Treatment and outcome. Eczema. No known cure, but it can get better and then get worse again. You apply steroids, cream, hydrocortisone cream or whatever. Light therapy, exposed to light, it seems to get better. And of course, apply a lot of moisturizers and emollients. Emollients are soothing things. Biologics, vaccines, growth factors, immune modulators, antibodies, blood and plasma derivatives. I was having dinner with some medical friends, and they were talking about stem cells, and they're saying that this extracts of placenta called exosomes are very potent for skin condition, and in fact they're using it. So this is something you can consider. This comes under biologics because placenta extract, for example, contains growth factors, immune modulators, antibodies, and so forth. Petroleum jelly is a sort of a lubricant to combat the dry skin. Avoid scratching, irritating substances that may trigger the eczema. So psoriasis, like eczema, there's no known cure. It can get better, but it can get worse. Treatment is to stop the skin cell proliferating and remove scales. Like eczema, light therapy works, and UV light apparently works. Steroids can be used. Tazorotine is a vitamin D analog. You can use salicylic acid shampoos, scalp solution, coal tar. Biologics also can be used. They have injected various powerful chemicals such as methotrexate or cyclosporin. Various lasers have been used. Excimer laser, which is a UV light laser, and ultraviolet A laser called Solaren PUVA, and Gogoman therapy, which combines coal tar with light therapy. So these are things that have been tried and appear to work. So psoriasis is, in a sense, much more serious than eczema. But both conditions, they come and go, depending on things. So treatment, topical, light therapy, injection, top foods to cure psoriasis, from aloe vera, apple, cider, vinegar, fatty fish, coconut oil, fish oil, certain kind of salts, not common salt, olive oil, tea tree oil, turmeric, sunlight. Certain diet are helpful, basically antioxidants, Mediterranean diet, or one rich in probiotics. So psoriasis, reasons why people have psoriasis is here. The consequences are here. The treatment, gels, ointments, creams, lotions, so forth. Okay? How about TeraHertz and stem cell? TeraHertz can downregulate and normalize cells. We say that TeraHertz has an effect on inflammation. So it reduces inflammation, it reduces itch, and therefore produces healing. In eczema, stem cell reduce inflammation, itching, and that's how it heals. For psoriasis, stem cells as anti-inflammatory as well as regulate the immune system, because this is an autoimmune disease. And I found out that trials of stem cell in both conditions are ongoing. So we should know more about this soon. So this is about TeraHertz heat therapy with TeraHertz is able to penetrate. Regular heat doesn't quite penetrate. So that's what TeraHertz do, is able to produce healing because it can penetrate right down to the muscle and get you well. Stem cells, it can promote healthy skin. So when in the skin, like in irritable bowel, there are dysfunctional stem cells there, and healthy stem cells injected go into it, and it modify them and cause the skin to be healthy again. So the fact that I can find this on the internet means something. There are a lot of people are working on these issues, using stem cells and using TeraHertz. Asthma. Anybody has asthma? One thing about asthma, you must realize that there's no cure, but remission is possible. That means it becomes better and you don't have episodes for some time. It is an allergic condition. There are a lot of environmental triggers, and the environmental triggers include pollen. Some people in temperate climates, when spring comes and there's a lot of flowering, there's a lot of pollen in the air, they get it. Infection, weather, chemical pollutants in factories and in certain places where there's a lot of pollution, acid reflux, exercise. The important thing is it can be triggered by stress and strong emotions. So, as you know, asthma, there's a lot of coughing, shortness of breath, and if you put your ear close to the body, you can hear this wheezing sound. Wee, wee, high-pitched wheezing sound. And there's a lot of chest tightness. So there's a lot of inflammation, there's swelling, the bronchus got narrowed, and the wheezing sound is produced like a flute or clarinet or a saxophone. They have a very narrow thing, and when it's very narrow, the air inside vibrate, produce this sound. So the wheezing sound comes from this narrowing of the bronchus. Okay, so a normal bronchus would have this. There is no wheezing sound because air can flow in freely. If you have a stethoscope, you put it to your lungs, you can hear the air rushing in and out, a whoosh sound, low pitch sound. But when it's narrowed, you have a high pitch sound, which is what your wheezing is all about. So wheezing is a typical symptom of asthma. Shortness of breath, chest tightness, chest pain, the difficulty in breathing and coughing at night. And usually associated, you have a rapid pulse racing, the sniffing. They are so breathless that they cannot eat, cannot speak, and they have difficulty sleeping. Easily drowsy, they can be confused, they can be exhausted by the effort needed to breathe and feel drowsy. Their lips can be blue and their fingers also can be blue because they don't get enough oxygen even though they breathe so hard. So, what about bronchopneumonia? Asthma is a disease of the bronchitis. The bronchus are narrow. Infection of the airways and the bronchus, and of course after for too long you get the infection. Pneumonia, where the infection go down into the air sacs of your lung. So bronchitis, you cough, mucus, sore throat, wheezing. And the chest X-ray, you can see when the air sacs are affected, because you can see there's a consolidation, you can see the solid lobe of the lung all filled with fluid. So there's a lot of phlegm, there's fever, there's shortness of breath. Bronchitis usually is very mild, like in asthma, but bronchopneumonia can be serious and deadly. In fact, in a lot of people who are compromised, like cancer, like chronic renal disease or strokes or whatever, they die from bronchopneumonia. And bronchopneumonia is often the cause of death. So bronchitis is this, pneumonia is this. You find that the distinctive feature is that there's fever, there's tightness, there's productive cough. In bronchitis, there's persistent cough, there's sore throat, but you don't get this, you know. So in bronchitis, parts of the lungs are affected. High-risk population means population with illness, chronic illness like diabetes or cancer. So you can see that on the X-ray. You find this part of the lung, this lobe, is solid, right? Because this is solid, this is the part where the pneumonia is. Or here, the middle part is solid. And this is where the pneumonia is. You can see it clearly on X-ray. So bronchitis has to do with your bronchus, the branch, the windpipes as they call it, and the tiny hairs on the bronchus may be damaged. In pneumonia, it gets into the lung tissues, the air sacs, where your exchange of gas takes place, where your oxygen gets into your blood and carbon dioxide get into the atmosphere. So you saw it on the X-ray just now, here. So what actually happened when you see this thing on the X-ray, where this thing is solid, inside is all filled with fluid. So what you see here, the opacity, is caused by the liquid accumulating inside the lung, and that's what happens in pneumonia. Asthma, symptomatic treatment. If you know of any asthmatic patient, they always have an inhaler next to them. This inhaler consists of medication which they can squeeze and deliver into their lungs. Okay. There are also oral medication that they can take to open up the bronchus so that there's no more wheezing. Other things you can do immunotherapy, allergy shots, in other words, to regularize the immune system. And you can use heat therapy, breathing, inhalation. You inhale the heat in and causing it to open up. And if there are certain things that precipitate the asthmatic attack, such as foods or irritants, you avoid them. And by tracking the symptoms of the asthma, the lung function, you can regain control over your symptoms. How about TeraHertz and stem cells for asthma? TeraHertz is able to reduce inflammation, improve your symptoms, and thereby reducing complications. TeraHertz has an antioxidant activity. Okay, it can help cells to regenerate and repair themselves. Stem cells, more than anything, it can reduce the allergic response of dust and pollutants. That's what stem cell is able to do. And increase resistance to colds and infections. And regulate the immune response and reduce inflammation. And it can regenerate normal lung tissue again so that your airways and your alveoli can function normally and not be so reactive to all the stimulants. So there you are. I found this very interesting thing. One effect of TeraHertz is that it can downregulate, normalize the genes. It can also upregulate at different energy. This is higher energy than this one. At different energy, it has different effect. That's interesting, isn't it? Because on your TeraHertz devices, there are different energy settings, low, mid, high. And depending on which energy you use, you have different effect. It can open up on the lungs. This thing, airflow becomes better. Stem cells, it can prevent respiratory distress. In other words, worsening of the symptoms, relieve hypertension, improve. It can do so many things, you see. So in asthma, stem cells can produce all these other cells. This is what we call that the exosome. The stem cells do produce this, which in turn can cause you to have healing. So that's from 1990 to 2020. 2020, the first time it was a clinical trial was done to demonstrate that this can actually happen. And of course, a lot of these things that stem cell produces, the immune cells, the cytokines, can activate more stem cells. And that's a very interesting thing. That's why in our ACEs we have this placental extracts. This is how exactly the placental extract work, this cycle. Is it clear enough, or do I need to explain some more? These are stem cells which are able to mediate the production of all these other immune cells, as well as the cytokines, the kind of chemicals, the kind of enzymes, growth factors which can produce healing, inflammation, remodeling. In other words, remodeling means you get normal cells appearing to replace the abnormal cells. And the presence of all those cytokines, all these chemicals, can stimulate further stem cell activity. So when you have something like placental extracts, which are basically all these things, all these chemicals, growth factors, cytokines and all that, they actually stimulate the activity of the stem cells present, you see. And that's why it's so potent. That's why ACEs is so potent. Chronic pain.
Can I ask a question?
Yes.
Can TeraHertz also stimulate stem cells?
It can stimulate stem cell activity. Activity of stem cells.
Not stem cells.
It doesn't produce stem cells.
But ACEs does.
Yes. ACEs, they choose those constituents for their ability to stimulate the release of stem cells. It doesn't produce stem cells, it releases stem cells. Okay? Huh? No. You must understand that when, let's say, you are 65 years old, by your age, by the time you reach the age, the amount of stem cells you produce get less. So, for example, if you take a combination of substances that are potent stimulants of stem cell release, so these stem cells are released, okay? They release in your bloodstream. When you release the stem cells into the bloodstream, the bone marrow will produce more, right? So if you keep on stimulating the bone marrow, then the bone marrow will be stimulated to produce more and more and more, okay? So that's why after taking about a few months, you find that if you can send your blood for examination, you find that the amount of stem cell release has gone up, okay? So in that sense, yes, it can stimulate the production of stem cells, but it's in a roundabout way. Okay. Now there's stem cells all over your body. When you stimulate activity, when you blow the TeraHertz, TeraHertz is external. Stem cell can only be released either from your fat cells or your bone marrow where there are plenty of stem cells there. Okay, in your skin there are stem cells available already, but it may not be active. When you blow, part of the recovery comes from the activation of stem cell already there. Okay? Is that clearer? So yes, we do say that TeraHertz do increase stem cell activity. It does. But you must understand the context. Okay? So chronic pain can be due to past trauma or current illnesses. For example, if you have diabetes with some wounds or cancer, you will have pain. Nociceptive pain. Pain of your body are called nociceptive pain. They are either somatic due to injury on your bones, joints, muscle and soft tissue, or they can be visceral. Visceral are pain in your internal organs. Your liver, your stomach, these are visceral. So there's another type of pain called neuropathic pain. This is a pain due to damaged nerve fiber. Sometimes you have pinched nerve, like on your backbone or spine. When it's pinched, as in prolapse disc, you have pain, or your elbow, wrist, carpal tunnel, where your nerve on your wrist is squeezed. And then there's a pain associated with psychological trauma. There's no physical injury. Perhaps this is true psychosomatic pain, which is something psychological that causes pain. So the causes of pain can be due to previous accidents, fractures, soft tissue injury arising from whatever the cause. And if your internal organs are damaged, your visceral pain, your internal pain arises from there. And chronic illnesses such as cancer, diabetes, strokes and so forth, neurodegenerative disease also can give rise to pain. And of course there's a lot of infections like shingles give you extreme severe pain. So you have the pain of osteoarthritis, lower back pain, cancer, autoimmune, nerve damage, injury. So there are these factors involved, social factors, biological, physical factors. So pain can be anywhere, isn't it? These are all somatic pain. So increased pain give rise to anxiety, sleep problems, not coping well, which added to the pain. In fact, if I can reduce your anxiety, give you good sleep, that you don't worry so much, your pain is actually that much less. So in fact, a lot of the pain that you feel is not due to any of this problem per se. In fact, by learning to deal with all these other things, you're able to reduce the pain. And this is something we know. That often the pain reduced not by reducing the pain itself, not by reducing the cause itself, but by removing all the psychological factors, the personal factors such as sleep, diet, everything, So everything, the more you don't enjoy, the more you feel negative, the more pain you feel. The more happier you are, the less pain you feel. And that's the basis for a lot of the modern treatment of pain. So pain can vary in severity. Shooting. If it's nerve pain, it will be shooting kind of pain. Burning, aching, piercing. There's discomfort, there's soreness, there's tightness, stiffness, fatigue. You can't sleep, your immune system is weakened. You tend to withdraw from relating to people, and you feel very hopeless. You become more anxious, hopeless, depressed, and then you're disabled. You can't do a lot of things because of the pain. So what can we do? Use antidepressants, use painkillers. Panadol is the simplest, NSAIDs. NSAIDs, as its name implies, non-steroidal. So these are drugs that are non-steroidal. They are not steroids. Steroids is the next level up. Steroids are further up. They are anti-inflammatory drugs. We want to reduce the inflammation. So many times people forget that painkillers, the NSAIDs, are actually anti-inflammatory. And this is one point I want to stress. There are other groups of drugs such as antidepressants, anticonvulsants, opioids. Opioids we tend not to give. Opioids we tend not to give unless it is a case of cancer. In cancer, we tend to give opioids too freely, a bit freely, because cancer usually are terminal, and when they complain of pain, we don't mind giving opioids, basically opium, to reduce the pain. But other than that, we use other things. So, and the other things, we make use of physical therapy, hot and cold packs. You can use hot or cold. Hot, you reduce the inflammation, you reduce the pain, you reduce the swelling. Massage, hydrotherapy, exercise. Exercise do reduce pain, surprisingly. And that's because if you're able to exercise in spite of the pain, exercise is a pretty strong stimulant of stem cells and stem cell activity. That's what many people don't realize. So all this can be tried. Psychological therapies, cognitive behavioral, relaxation, meditation. I would say that cognitive behavioral is pretty powerful. I often would teach a combination of relaxation, therapy, and meditation, and they're pretty powerful as painkillers. In fact, you feel less pain after doing this. Another one is acupuncture. Acupuncture makes use of the mind-body techniques that meditation embodies. Is pretty powerful. Acupuncture also makes use of meridians, if you know. And group, social. When you see, pain makes you focus on the internal, on yourself. So the more you focus on yourself, the more pain you will feel. But support groups, by forcing you to focus on other people, take the attention from yourself, you actually feel better. Worst come to the worst, if the pain is too terrible, there are things like nerve block. When you inject steroids into the carpal tunnel, for example, or to the back of the spine, because of the prolapse, this nerve block, surgery, any topical things will help. Surgery in the spine, in the carpal tunnel, they will relieve the pressure by cutting the ligament there that cause it to be compressed. In the back, surgery sometimes means that you immobilize the spine completely by putting plates there and screws so that your spine is fixed and you can't move your spine anymore because it's immobilized. A lot of people with spinal spondylolisthesis. Spondylolisthesis, when not only is the nerve compressed, but the compression is due to the fact that your vertebrae don't sit on one another squarely. It kept slipping. And because it kept slipping, there is a risk that it can cut off your spinal cord completely. And when you cut off your spinal cord completely, what happens? You have paralysis of the lower limbs. So to prevent this happening, you need to immobilize the spinal cord. That is the basic idea. So stretching exercise, you can stimulate. Effect of stimulation is like acupuncture. You stimulate other nerves. So it's like the expressway. If there's a lot of car, everything becomes slower, right? If there's a lot of traffic, car go slower. And if there's a lot of traffic, the essential car, the ambulance, for example, can't even go through. It takes a long time for the ambulance to go through. So that is the idea behind electrical stimulation. It kind of sends a lot of signals out, so there's no space, no time for the signal, pain signal to go up into the brain. Injection, Botox. Botox works. Botox actually paralyzes your nerve and your muscle. That's how it works. So there you are. Neuropathic pain treatment, anticonvulsant, antidepressant, anesthetics, NSAIDs, all this. So the cycle, your thoughts, negative thoughts make it worse. Better thoughts, feelings, body, sleeping issue, tiredness, tension, all this aggravate the pain, and behaviors. That's why exercise is able to be effective. Physiotherapy or mobilization is very important for pain. Alternative treatment, yoga, acupuncture, massage, meditation. Tai Chi has the effect. Tai Chi also works along meridian lines and aerobic. Okay? How does TeraHertz and stem cells help? TeraHertz suppresses conduction of pain impulses, and TeraHertz can relieve neuropathic pain. This is very important. Nerve pain sometimes cannot go away, but TeraHertz is able to do so. TeraHertz has the effect of vibration, as I said earlier on. Vibration is a very effective treatment for a lot of things. Counter irritation. Counter irritation is just like applying tiger balm. It kind of irritates and makes you don't think about it. It also releases a lot of other things like endorphins, substance P, which can relieve your pain. Stem cells is able to reduce inflammation, regenerate and repair damaged tissue. And it can relieve joint pain and neuropathic pain. There are neurons that are called pain-killing neurons, and it's been shown that stem cells is able to stimulate the production of pain-killing neurons. So TeraHertz can be applied anyway. Stem cells, you can inject stem cells, and this is how it works. It releases growth factors that combat arthritis, enable healing mechanism to repair cartilage and chronic pain. Pretty potent. Okay? Chronic fatigue. Again, this affects mainly females, 40 to 60. Tiredness not relieved by rest. Worse on physical, mental activity, including standing for long periods. As a result, the people are housebound. Oxidation symptoms are there's a brain fog, they can't think clearly, they can't concentrate, they lose the memory, sleep problems, all kinds of pains, very sensitive to light, sound, smell, food, or medicine. And of course, sometimes there are physical symptoms like headache and sore throat. Not well understood the causes of chronic fatigue. It can be triggered by viral infections such as glandular fever and so forth, COVID-19. One important finding is that the low levels of white blood cells, a white blood cell called NK cells, natural killer, they fight infections are very low in chronic fatigue. And emotional trauma such as surgery, bereavement, shock appear to be, there appear to be some genetic predisposition in chronic fatigue, and exposure to all these things, anesthesia, immunization, hormonal imbalance, and trauma may be triggers. This thing about COVID-19 is very real. Some of the chronic fatigue symptoms that you see in COVID-19 is due to chronic fatigue. And you hear about this. You read about it in the news. So the symptoms, you have sore throat, you have painful lymph nodes, chills, night sweats, shortness of breath, muscular weakness, irregular heartbeats. They are very sensitive, allergic to foods, odors, and all that. They have difficulty coping and can't live a normal life. Huh? Chronic fatigue, yeah, or CFS, chronic fatigue syndrome. So basically it's fatigue. You exclude all other causes believed to be triggered by genetic or viruses such as COVID or toxins, and treatment including life change. So fatigue, headache, loss of memory, joint pain, disturbed sleep. It's estimated that Singapore has about 0.1% of people suffering from this. So that's about quite a lot. Huh? So again, it's related to the gut. That's why a healthy diet is important. It's related to hormones, trauma, lack of sleep, gut again, your nutrients, your mitochondrial health. This part is important. Remember this one, chronic fatigue. Treatment, a lot of medication has been tried to treat the pain, the fever and everything. Change the lifestyle and change the behavior to cope better with it. Physiotherapy, activity management, balance the rest of activity, pacing technique to maintain steadiness, control over activity. Salt tablets. It's interesting about the salt tablets in chronic fatigue. They found that in chronic fatigue, there is more salt in muscle cells than in the bloodstream, which means that the sodium chloride has gone into the muscle cell. So without sodium chloride, you feel very weak. And so that's why salt tablets help. So, of course, this has to be on the advice of doctors. You take too much salt, you can get high blood pressure. You know that, huh? No, you got to be able to demonstrate that your blood sodium and the chloride are low, and in the muscle is high. So the salt tablets help to improve it. Melatonin is supposed to help. Melatonin helps by regulating the sleep-wake cycle. So you got to exclude. A lot of these conditions have a similar profile to chronic fatigue, and therefore you need to see somebody who can work through your symptoms and eliminate all these other conditions. So chronic fatigue treatments, emotional and physical treatment, medication, fixed sleeping hours, intake of fluid and salt, exercise, stretching, massage, acupuncture, deep breathing, and meditation and yoga for reducing stress. How about TeraHertz and stem cells for chronic fatigue? Properties of TeraHertz will relieve the pain, the tiredness, uplift energy and mood. They found this. In chronic fatigue, there is mitochondrial failure. So TeraHertz is able to activate and make it normal. Remember, we said earlier on that the mitochondria is where your body produces all the energy that enable you to be active and move about. So trials have been tried where chronic fatigue were put on prednisolone, and improvement seems dramatic. Prednisolone suppresses inflammation, and if it improves, this suggests that there is an inflammatory element to chronic fatigue. The symptoms that improve: fatigue, fever, pain, sleep disturbances. Stem cells help you to recover function of your nerves as well as the immune system, and it can regulate your nervous system and symptoms increases. In a way, it helps to have stem cells to make your nervous system and your immune system to be normal. As far as psychosomatic disorders are concerned, the anti-inflammatory effect can relieve pain, itch, and other symptoms, because a lot of symptoms arises from the inflammation. The improved circulation induced by TeraHertz can lead to symptom relief and regulate and normalize your immune system. And of course, TeraHertz has an antioxidant effect, which protects you. More important, TeraHertz can induce a state of tranquility, helps you to calm down, and it can uplift your energy level, give you a sense of vitality. And it can induce repair and regeneration of normal tissue. That's where the stem cell activation comes from. Stem cells and stem cell nutrition in psychosomatic disorders affected by strong emotion and mood due to faulty autoimmune and inflammatory functions. Therefore, stem cells have been shown to provide symptom relief. And stem cells can repair and regenerate tissue damage, especially in the nervous system. And if there's improved immune function, there is a lower risk of infection, and with improved function and normal health, you get back your strength from the stem cell. So psychological aspect of psychosomatic disorders, you need a holistic approach because it has contributory factors from many areas. So therefore, social connection and social ties are important. Motivation, attitudes, meaning, purpose, and spirituality is important. That's why meditation and mindfulness works. That's why stress management and self-regulation works. And you need to manage your energy balance, which is the balance between input versus output. Of course, in many conditions such as obesity, this balance is gone. So I've selected some quotes that can kind of express this balance. Keep your face always towards the sunshine. Your shadow is always behind you. Very true, isn't it? For success, attitude is equally as important as ability. And this goes for recovery from illness as well as being successful. Recovery from illness, attitude is as important as the ability to do so. Same for success, in business, in whatever. And This is the wellness. Wellness inventory is a device to measure how well you are. It doesn't look at how healthy you are, how well you are. And it looks at different elements from breathing, sensing, eating, moving, feeling, thinking, playing, working, communication, intimacy, finding meaning, transcending, self-responsibility and love. So some of it are input. Self-responsibility and love, breathing, sensing, eating, move, feeling, and so on. They are input. Some are output. Moving, playing and working, communicating, intimacy, finding, moving. So the input and the output must be balanced. So this is a very useful model to find balance in your life. So if you want to get started on balance, the way to get started is to quit talking and begin doing. Like what Nike say, let's do it. So is you mindful or you mindful? Mindful means your brain is full of activity. I introduced this concept to you. When your mind is very active, is in a dominant mode, default mode network, DMN. Our body has our brain has a certain activity. I'll show you. Our body is a default mode network. How do you know you have a default mode network? Just focus your mind on anything. Just be calm and try to focus on something, your breathing perhaps, or your sensation perhaps, and then you realize there's a lot of activity in your mind. You think about this thing, you talk about that thing, you think about what you're going to do next. This is a default mode network. Your brain is always active. It's just that because you're not paying attention to anything, you are not aware of it. This, your mind is always full of things. But mindful is when you focus on something. Let's say I want to play some game, basketball, whatever. I want to throw the ball at a particular place. I want to kick the ball at a particular place. Or I want to focus my mind on doing something. This mindful, to pay attention. When your mind is full, you're the default mode network. There's always something in your mind. When you're mindful, you are focused. And to have improvement on whatever, you need to focus. In the West, people tend to focus on process, how we do things. In the East, we tend to focus on intention. When we focus on intention, that's how the karate person is able to knock all the bricks into two, because the focus is on intention. That's what Tai Chi is all about. So when you're mindful and you have this attitude of great gratitude, you're able to have accomplishment. It has been said, people have found that when they are grateful, when they note down things that are grateful for, they are more calm, they are more effective as people. So you find in the self-help literature, maintain a gratitude diary to help people to focus, to help people to calm down, to help people to be more productive. And if you're religious, you know you must be thankful, isn't it? Huh? So that's what gratitude is. Combine the two together, that's where you can achieve things. So, that's what iTeraCare is all about. is for all these things. Inflammation, pains, and we covered this today. Blockages and skin condition. We cover some skin condition today. Okay? It's not recommended for all these things. But I can tell you that on my own authority, this is what Prive International tell you. But I tell you another thing. Object implant can. You can use TeraHertz on that. Open wounds can. You can use on it. Why? Very simple. People who created implants know that these people will need to go for treatment sometime or the other. Right? So they choose the kind of material that is not affected by lasers. And implants are made from titanium, which is unaffected by lasers. And you want me to justify? I can quote to you all the experts that say so.
What about the silver inside?
Same thing, it's made of titanium. It's a material. They choose titanium because you cannot predict whether this fellow needs to go for lasers or not. Right?
So make it foolproof.
Yeah. I mean, medical people have thought about the consequences of the choice. Of course, Prive International being not a medical organization, they don't know. And their main concern is to indemnify themselves. I can understand it. But I'm saying, because people with implants would need lasers and other medical treatment, they also need TeraHertz.
So we can just blow onto the same part again, no problem.
No problem. Lasers are even more powerful than your TeraHertz, more energy.
So it's not true that if there's an implant here, we don't blow here, right?
No.
You still blow on.
You must understand your TeraHertz is self-help device, home device. Lasers, medical lasers, are more intense. Huh? And you can't use the medical lasers. You need to be trained because you need to be aware that you can overuse it. This one, do you need training? So, do you believe me? Do you believe all the experts? Or do you
So
believe?
Use, the higher heat is okay, no problem.
How high can this go? I tell you, if you map out your TeraHertz, you find there are two circles. This very intense, right? And this larger area not so intense, isn't it? And depends on how far away from the skin it is, right? The closer it is to the skin, the smaller is the outer circle. Medical lasers, very intense. The outer circle is very small. It's very small. It's very targeted. You need to remember that. I say this on the authority of various experts. Huh?
What about laser?
Huh? Same.
Laser in the eye.
Same.
Same.
Doctors
So
have
blow like that.
doctors have thought about it.
Okay.
Doctors have thought about it.
All right. Good that you
Wound infection. Prive International says no. I say yes. Why? I have found at least 2, if not more, papers that talk about how TeraHertz is being used in open wound and facilitate healing. If experts have done the research, who am I to contradict them? I will go with it. You must understand, Prive International don't want legal indemnity. By all means, you do it on. You listen to them if you want to follow them. If you don't want to listen to them, don't depend on them. They won't pay you because they already cover themselves. You see? But that's what the scientific literature says, and I go by scientific evidence. I'm not a lawyer. Huh? Yeah, I'm telling you facts as it is.
The one about the menstruation, the lady one?
Huh?
The one menstruation also can.
Actually, I must find some expert to say this. I must find a gynecologist who will say this. But I think it should be okay. I think it should be okay.
I disbelieve when we do this normal monitoring, and then there's a lot of blood going out. According to what I know, I heard from them, from the prime people.
I go by evidence. I go by evidence.
How many evidence?
I have not researched this. When I research, I tell you.
Okay, good.
Okay. Yeah.